Our sight is one of the most treasured gifts that we often take for granted. It allows us to see the surrounding beauty and tragedies of our world has to offer. With that in mind, today we'll be talking about the organ that makes all of these possible, our eyes. We hope that you watch till the very end as we look into the questions that will surely catch your attention. I am Jed Liano, your host for today's episode of Lifeline, where we improve our lives by feeding our minds. Joining us today is Dr. Ito Sutanco, a physician and a board-certified ophthalmologist. We're glad to have you, Doc, here in our lovely... So how is your day naman po so far?
Yes, good afternoon. It's a pleasure to be here. My day has been okay. Just came from the clinic and I'm glad to be here.
Yes. And we are also glad that you are here with us today, and we are honored that you will be able to share some insights with us here on Lifeline. So, again, we are also thankful for taking us the time to enlighten us with today's topic. So, to begin, Doc, let us start off by asking you to describe to us what is actually the human eye? How do we actually able to see?
So the human eye, as you said earlier, is one of the organs of our body, just like the heart, the lungs, etc. I would like to think that the eye is perhaps one of the most complex organs
Yes.
because even if it is small compared to the heart, the lungs, etc., it is very complex in that it requires a lot of physiological, anatomical, and chemical processes that need to integrate and work well in order for us to produce a crisp image.
All right. So we definitely could see that our eyes are really is complex. So ato doc, medyo curious din ako for this question. How does prolonged screen time affect our eyesight? Most especially now in this age, very exposed tayo sa mga gadgets. So how does prolonged screen time affect our eyesight?
Prolonged screen time, to a degree, entails prolonged near work. And as the modern world produces more digital devices, as we evolve, naturally, we have more screen time. Our body naturally adapts to our daily activities. And so if we have a lot of screen time, the eyes will naturally adapt to that, and hence there will be our eyes would result to being nearsighted.
Mm-hmm.
And that this is why the children these days, according to studies, have increased prevalence of being nearsighted.
Right. So doc, are there any causes or factors that affect the deterioration of our eyesight?
That's a good question. There are a lot of causes or factors that affect deterioration of our eyesight. And perhaps the most common and the most inevitable cause or risk factor is aging.
Mm-hmm.
Because of course, as we age, the organs inside our body age as well,
Yes.
and the eyes are not exempted from that. Other factors include systemic diseases such as hypertension or high blood, diabetes, autoimmune diseases, and even as simple as infections can also lead to deterioration of our eyesight if left untreated.
So marami po talaga mga factors that affect the deterioration of our eyesight. So, Doc, is poor eyesight naman hereditary? If so, could you mention some of the preventive measures in order to preserve our perfect eyesight?
In your question regarding if poor eyesight is related to
Hereditary.
if it's hereditary.
Yes po.
Okay, it depends if the systemic disease is hereditary as well. For example, hypertension and diabetes are some of the conditions that are hereditary. Hence, those diseases can also lead to poor eyesight. With regard to being nearsighted, or the error of refraction as we call it, it can also be hereditary. For example, if both your parents are nearsighted, there is a big chance that the offsprings will be nearsighted as well, and vice versa. If they are farsighted, there is also a chance that the offspring will be farsighted as well. But this is not the only factor. There are other factors.
Yes.
So the perhaps the most or the best preventive measure is to have a regular eye exam,
Eye exam.
because the most of the eye diseases are undetected if no eye exam is done,
Yes.
especially the early stages of certain or some eye diseases.
Yes. So it really is important na magpa-eye exam na tayo if we feel like there's some we are starting to feel something in our eyes. So could you walk us through naman, Doc, some of the common eye conditions, since we've been mentioning yung mga factors nito? Ano yung mga common eye conditions that are especially prevalent among people with advanced age?
Perhaps the most common eye condition in the among senior citizens is cataracts.
Cataracts.
Cataracts happen when the lens inside our eye opacifies. So when I say so the we all have lenses inside our eyes.
Mhm.
The lenses, just like the lenses in our camera, they're supposed to be clear and transparent
Yes po.
in order for the cameras in our phone to be clear. Okay?
Mhm.
So whenever the lens becomes dirty, whenever they become different in color, like yellow, brown, white, sometimes black, that's what we call cataracts. So cataracts happen most oftenly in people within the advanced age. But there are also other risk factors for cataracts, like, again, hypertension, diabetes, trauma, and a lot of other diseases, which is why people develop cataracts at different times or in their life.
So parang, Doc, hindi naman siya necessary na it happens sa old age, pero everyone can have cataract.
Yes, some people develop cataracts earlier than others. Even babies can have cataracts, depending on the risk factors.
Alright. So so super important talaga na meron tayong eye na nagpapa-eye exam tayo for us to avoid these kinds of diseases. So thank you so much, Dr. Yutanko, for answering some general questions about our eyes. For our next set of questions po, we will be focusing more on the symptoms and process of diagnosis on the common eye conditions.
We are happy to be part of this global activity of spreading awareness against cancer. UST Hospital, together with the Tomasian community, is working together to educate our medical staff and patients to contribute in making this world a cancer-free place. Through this effort, may we promote healthy lifestyle, enhance awareness among Filipino people, and make a mark in reducing the global impact of cancer. We salute the men and women who continuously fight to survive and win this battle against cancer. Together, let's close the gap in the treatment of cancer care.
The will to live is a natural desire for all human persons, especially those who are battling diseases just like cancer. The whole Tomasian community, especially the University of Santo Tomas Hospital, through its Benavides Cancer Institute, commits itself in its fight against cancer. Together as Tomasians, let us support those people who have dedicated their lives in terms of their research and study about cancer. Let us hope and pray for cancer patients that they might have renewed faith and hope that their health may be restored and that happiness may reign in their families. God bless us all.
You guys are still here with us in Lifeline. So after diving into the generalities of the human eye, let us now see what are the symptoms, signs, and process to diagnose on the common eye conditions regularly experienced by most of us. So, Doc, can you elaborate on why refractive errors or difficulties on eye focusing regularly occur?
As I said earlier, our eyes are very complex.
Mhm.
So all the parts of the eye needs to be in perfect condition in order to produce a crisp image. The lens and the cornea, the front part of the eye, are major parts that are needed to function properly in order to produce a crisp image. So if there is a problem in the cornea and the lens, there will be a problem in when it comes to producing a crisp image. And not only the lens and the cornea, the other parts of the eye contribute as well.
Mhm.
And this is why whenever we examine the eye, we look at all the parts from front to back, because anything that obscures the image
Yes.
from getting into our brain would result to blurred vision.
Mm. So now, Doc, how do the four primary categories of refractive errors, astigmatism, presbyopia, hyperopia, and hypermetropia, and myopia differ from one another?
Okay, so we'll start. So myopia, hyperopia, and presbyopia are all errors of refraction. This largely involves the shape of our eye. So basically, if our eyeballs are long compared to normal, this results to myopia or being nearsighted. If our eyeballs are shorter compared to normal, this results to hyperopia or being farsighted. And presbyopia happens in people over 40 years old, wherein their eyes are clear, they are 20/20 at far, but when they are reading, they require reading glasses. And this happens because as we age, especially among 40 years old and above, the muscles of their eye start to have difficulty in focusing. So people age 40 years old and above start to be reliable on reading glasses.
Glasses. Yes. Yes. All right. So thank you so much for differentiating those, Doc. I mean, personally, this is my first time hearing those kinds of terms in terms of our eyes. So it's really important that we were able to listen what Doc has mentioned about the differentiation of these things. So, although considered as prevalent, grievances having dry, sore, blurry, and tired eyes are conditions that typically go away on their own. But how do we know when we need to consult a medical professional? Since parang nagiging conception po sa atin yan na parang, mawawala naman yan kapag, so hahayaan ko na lang. So how do we know?
The symptoms that you mentioned earlier, tired, dry eyes, those are symptoms of eye strain, wherein the muscles of our eyes get tired because of prolonged focus on a single object. These usually go away on their own whenever we rest our eyes. Appropriate consult with an eye doctor is needed whenever they don't go away on their own, because there is a chance that there is another problem. So, as you mentioned earlier, yes, they go away on their own. But if they don't, then consult is advised.
Yes. So, yan guys. So, it's really advisable if hindi siya nawala ng kusa na magpa-eye consult tayo sa mga doctors natin. So, now Doc, can you walk us through the process of how to diagnose an eye condition? What screenings or testings should a patient undergo when undergoing eye consultation?
Okay, so a complete eye exam must be done in order to in order not to miss out any eye condition. And we usually start with the visual acuity. When I say visual acuity, this is the test being done in driving tests in order to see if you're 20/20 or not. Okay? In visual acuity, this is when the examiner lets you read letters
Yes.
from biggest to smallest. That's the visual acuity, and that's where we start. After visual acuity, we proceed with the what we call the slit lamp examination, wherein we use the microscope to examine the eye. Since the eye is small, we need a microscope in order to look at the eye. So just gross examination is not enough. Alam mo yung usual na whenever someone would say na I have an eye problem, tapos
Yes po.
gaganin lang nila yung eye nila. So we gross exam is not enough. So the microscope is needed in order to look at especially the internal structures of the eye. So after visual acuity, we look at the structures of the eye. We look for signs of infection, inflammation, abnormalities in the anatomy in the eye, up from the front, systematically up to the back, up to the optic nerve. The nerve is the structure of the eye that is located at the backmost part, inner backmost part.
Yes po.
The optic nerve is connected to the brain. So any signs of inflammation in the optic nerve or abnormality, this is usually connected to the brain. So depending on our findings, we refer to a neurologist,
Yes.
we refer to a cardiologist, we refer to others specialties depending on our findings. Also, we check the intraocular pressure because our eyes also has pressure inside. So if there is increased pressure in the eye, appropriate medication should be given. We add additional tests. We also check for the visual fields, meaning how far can we see,
Yes.
if there is tunnel vision or not. That's the visual field. Because there are also conditions that are related to visual fields. So yeah, from visual acuity to the internal structures of the eye,
Yes.
from front to back, to the eye pressure, up to the optic nerve examination, visual fields. Sometimes we also dilate the eye in order to look at the retina.
Yes po.
So basically, we need to see all parts of the eye as much as we can in order to not miss anything out.
So we definitely could see how complex our eyes are, kaya napaka-important yung mga processes na ina-undergo natin in terms of our eye condition. So now, Doc, we've been talking about the processes in terms of consultation. So what would happen if an eye condition was left untreated?
Well, the worst is a person goes blind because there are a lot of diseases that, if left untreated, could result to blindness.
Yes.
Blindness could be either permanent, meaning irreversible, or it could be reversible. So there are conditions that are reversible, there are conditions that are irreversible. And aside from blindness, other adverse effects if an eye condition is left untreated could examples include infection, inflammation, and others.
So, ito, Doc, medyo curious question. Is there such a thing as eye cancer po ba?
Yes. Some parts of the eye also have specific cancers. From the conjunctiva, which is the part of the eye that turns red whenever we have sore eyes.
Yes po.
So that specific part can have cancer. The retina can have cancer as well. The brown part
Yes.
the colored part of our eyes can have cancer as well. And also not just the eyeball particularly. There could also be tumors surrounding the eyeball.
Yes po. Alright. So now that you've mentioned nga po itong mga diseases natin, are there any alternative home remedies such as utilizing different food or herbs to help an individual's eyesight?
Just like other systemic conditions, healthy food, the generally healthy food that vegetables, avoid excess food that are rich in fat, etc. So generally, just vegetables to keep our eyesight healthy. Carrots,
Carrots.
vitamin A.
Yes po.
Those uh, those are some examples of healthy food.
Yes po. Alright, so guys, if you want to take care of your eyes, eat healthy, have a great lifestyle, of course, eat vegetables, yun yung paalala sa atin ni Doc. So thank you so much, Doc. Everything that had been said by Doc. Yes po, Doc.
Yes, I forgot to mention a healthy lifestyle, as you mentioned, is also important, especially if people have certain conditions like hypertension, diabetes. So it's important to control the blood sugar and the blood pressure. It's important to control the systemic conditions as well, because those systemic conditions can affect the eyes.
Yes. All right. So thank you so much again for that, Doc. Again, we'd like to remind everyone, to all our viewers out there, to eat healthy and have a healthy lifestyle. So everything that had been said by Doc Aitos Yutanko truly opened our eyes to clearly see the importance of the windows of our souls. I spy with my little eye treasures and wonders of the world. That is why it is always a must to take care of it. Despite having technologies enough to combat it, prevention is still always better than cure. With that being said, this has been Jed Liano for Lifeline, where we improve our lives by feeding our minds.